Immunization Orientation. Thank you for helping the Flu-IMS program provide this vital service to our community. This brief orientation video provides important information on laptop access and connectivity, immunization program information, clinic logistics and documentation, employee schedules, time reporting, parking and mileage reimbursement, and certifications and trainings. In addition to this orientation video, you will need to watch several other instructional videos, all of which are part of the orientation training series. You will find these videos in the same YouTube channel as this orientation video. Please watch this video from start to finish. Should you need a refresher, use the chapter markers to the right to skip around and rewatch topics as needed. Laptop access and connectivity. Logging into your laptop. Step 1. Power on your computer. Step 2. Enter your unique name. Step 3. Enter your Level 1 password. Step 4. Click Login. You should now have access to your computer. Accessing Wi-Fi at off-site clinics. Step 1. Click on the computer icon located in the lower right corner of the monitor. Step 2. Locate the Wi-Fi symbol and click on the right-facing arrow to view a list of available Wi-Fi connections. Step 3. Select the desired hotspot ID or the Wi-Fi name from the list. There may be several Wi-Fi options with similar names. Be sure that you've selected the correct one, which will be noted on your schedule. Step 4. Enter the Wi-Fi password in the space provided. You should now have access to the internet. Accessing MyChart with VPN. Step 1. Click on the Start menu icon in the lower left corner of the screen. The Start menu window will open. Step 2. In the Start menu search field, type Cisco. The Best Matches section below the search field should show the Cisco Secure Client application. Click on Open to start the VPN client. Step 3. Enter your unique name and password, then approve the Duo notifications. You should now be able to sign into MyChart. General Immunization Program Information. U.S. flu season preliminary burden estimates. Since October 1, 2024, the CDC estimates there have been between 47 to 82 million flu illnesses, 21 to 37 million flu medical visits, 610,000 to 1.3 million flu hospitalizations, and 27,000 to 130,000 flu deaths. Clinic locations. Clinics are referred to as either primary care clinics or community clinics. Community clinics include all clinics that are not located at a primary care location. Primary care clinics are provided at the Brighton Health Center, the Northville Health Center, the Canton Health Center, and others. We also provide off-site clinics at U of M campus locations, churches, community centers, and corporate sites. Flu vaccine composition and details. All flu vaccines for the 2025 to 2026 season are anticipated to be trivalent in the United States. Trivalent flu vaccines are formulated to protect against 3 flu viruses: the A Victoria 4897, 2022, H1N1 pandemic 09 like virus, the A Croatia 10136RV, 2023, H3N2 like virus, and the B Austria 1359417, 2021, B Victoria lineage-like virus. Both trivalent and quadrivalent flu vaccines are expected to offer similar protection against the flu viruses they target. COVID vaccine composition and details. You will be emailed information on the COVID vaccines as it becomes available. Standing orders. A link to the flu vaccine standing orders is provided below. The standing orders will also be available on Google Drive. Flu vaccine reminders. Everyone 6 months or older should get an annual flu vaccination. For primary care clinics where flu mist is available and requested, use the screening document in the standing orders to ensure that flu mist is appropriate for the patient. Flu mist is indicated only for healthy patients between the ages of 2 and 49 years who are not pregnant. Children between the ages of 6 months and 8 years who have not received 2 doses of flu vaccine prior to July 2025 should receive 2 doses at least 28 days apart. Egg allergy is no longer a contraindication to the flu shot. All patients who are age 65 or older should receive high-dose flu vaccine. It is acceptable to administer the regular flu vaccine if the high-dose flu vaccine is not available. Patients should be informed that the high-dose vaccine is recommended but unavailable, and that administering the regular flu vaccine is acceptable under these circumstances. Remind patients that illness can be just a plane ride or a lunch date away. Patients between the ages of 18 and 64 who have had a solid organ transplant and are on immunosuppressives should receive high-dose flu vaccine even if they are under age 65. Refer to the SOT, or solid organ transplant, column in the IMS clinic schedule. This column will show yes for patients who have had a solid organ transplant and are on immunosuppressives, or will be blank for patients who have not had a solid organ transplant. Hypersensitivity anaphylaxis protocol. If a patient experiences hypersensitivity or anaphylaxis following an immunization, initiate treatment as outlined in the UMH Emergency Management of Infusion-Related Anaphylaxis or Hypersensitivity Reactions Policy 07-01-014, available in Google Drive. After initiating treatment, stabilizing the patient, and calling 911, someone within the clinic must page the supervising provider at the link shown. Paging instructions are available in Google Drive. Documentation must be completed in MyChart using the Smart Phrase and Smart Set. Please refer to the following instructional video. Details are also available in Google Drive. Emergency kit contents: 1 anaphylaxis kit, 1 blood pressure cuff, 1 stethoscope, 1 cold pack, face masks and disposable apron, disinfectant wipes, thermometers and covers, 1 red Hez bag, 1 CPR face shield, 1 child airway, 1 adult airway. Anaphylaxis kit: 2 diphenhydramine 50 mg 1 ml, 1 adult epinephrine autoinjector, 1 EpiPen Jr., 2 epinephrine 1 mg 1 ml vials, 2 hydrocortisone 100 mg 2 ml, 2 3 ml Luer lock syringes, 3 1 ml Luer lock syringes, 2 1.5-inch 23G needles, 2 1-inch 25G needles. Clinic logistics. Clinic arrival. Your schedule will indicate if you need to drive yourself to the clinic location or if you should meet at KMS. If meeting at KMS, the meeting time will be noted on your schedule. Your hours worked begins when you arrive at KMS. If driving self, arrive at clinic location 30 to 60 minutes prior to scheduled start time. Your hours worked begins when you arrive at the clinic site. Nurses, please wait in the lobby for registrars to arrive so that you can help carry in supplies. Clinic setup. Charge nurse or designee, determine the best way to set up the room to ensure patients understand where to go. All staff, log into your computers and connect to MyChart right away. Charge nurse or designee, check the temperature of the vaccine inside the cooler. If the temperature is outside the acceptable range, verify that the vaccine is still suitable for use by referring to the stability calculator. Charge nurse or designee, confirm that the emergency anaphylaxis kit is full. Do not tear open the medication bag. All staff, unpack necessary supplies and ensure workstations are neat. Help each other. Registrars, ask nurses if they would like you to open supplies. Temperature tracking. If the temperature is not within 36 degrees to 46 degrees Fahrenheit when off-site, you must confirm the stability of the vaccine by checking the stability calculators located on the websites shown below, and complete the excursion log located on Google Drive. If the vaccine is not suitable for use, call the office immediately for replacement vaccine. Clinic departure. All staff. Pack up all supplies, paperwork, etc. and return to office for proper handling. Notify the clinic contact of your departure. If someone wants a flu shot after you've started packing up, give the shot. Our goal is to avoid missed opportunities to vaccinate. Vaccine retrieval process for all clinics. It is the vaccinating nurse's responsibility to confirm with their patient the specific vaccines the patient wishes to receive. After screening the patient and verifying that the patient age is appropriate for the vaccines they want, it is the vaccinating nurse's responsibility to retrieve and administer the correct vaccines for their patient. The vaccinating nurse will document all vaccines administered in MyChart and on paper if at a community clinic. The patient may leave the vaccinating nurse's station after all charting is complete. The charge nurse may use their discretion to decide if more than one dose of vaccine may be at a vaccinator's desk. For example, at busy clinics where only flu shots are being administered, it may make sense to allow each vaccinator to have one box of regular flu vaccine at their desk. However, this practice may not be possible at clinics where vaccinators are administering COVID, regular flu, and HD flu vaccines. Vaccinators are responsible for their clinical practice. New screening process. Patient screening questions are located at, and must be completed within, the IMS clinic section in MyChart. At check-in, clerical staff will give each patient a vaccine information statement for each requested vaccine. If this is not done at a primary care location, the vaccinating nurse must provide it before administering the vaccine. Vaccinators must ask their patient each screening question in IMS clinic. Questions not relevant to the vaccine being given may be skipped. If a non-applicable question is marked yes, the vaccine may still be administered. Adding a comment is not required. If a patient indicates they have a contraindication, the nurse must consult the charge nurse. The charge nurse may need to consult our supervising provider. If a patient is deferred due to a contraindication, the vaccinating nurse will document the reason for deferral in MyChart. When a patient has a contraindication to the flu or COVID vaccine at a primary care location, do not immediately defer the vaccination. Ask the patient to wait so you can consult with the on-site doctor of the day. The charge nurse should find the lead MA, or a health center leader, and ask for the doctor of the day. The charge nurse or other clinical designee should consult with the doctor of the day to determine if the vaccine should be administered to the patient. If the doctor of the day approves proceeding with the vaccination, document this in the comments section of IMS clinic as Doctor of the Day consulted and approved vaccination. The patient should be asked to sit in the observation area for 30 minutes. If the doctor of the day does not approve the vaccination, you must document the reason for deferral in MyChart, which is covered in the upcoming Documenting a Deferred Vaccination slide. The following are reasons we do not defer vaccinations at primary care locations. 1. Where else are they going to get vaccinated if they can't get vaccinated at a physician's office? 2. It may not be considered safe to administer a vaccine to a patient at a church or at the worksite, but it may be considered safe to do so at a primary care location. When at a community clinic, charge nurses should be consulted before a patient's vaccination is deferred. Charge nurse may consult our supervising provider or may agree to defer the vaccination using their own clinical judgment. Deferred vaccinations must be documented in MyChart as shown in the upcoming Documenting a Deferred Vaccination slide. Documenting a deferred vaccination. Step 1. Highlight the patient's name in the IMS clinic schedule so that it appears in the middle ribbon section of IMS clinic. Step 2. Click on Immunizations, which is located in the middle ribbon section of IMS Clinic. Step 3. Click on Historical Admins, which is located underneath the Immunizations tab. Step 4. Scroll down until you see the name of the vaccine to be deferred. Step 5. Enter the date and the deferral reason in the spaces provided. Step 6. Click Accept. The vaccination deferral has been documented. Community Clinic Documentation. Each vaccination administered needs to be documented on our 2-part carbonless paper documentation form. The patient must complete the demographics section. The vaccinating nurse will check the appropriate boxes and write in the lot number. The vaccinating nurse will provide the yellow copy to the patient and retains the white copy. All completed forms must be returned to the office after the clinic by the clerical staff for proper handling. Each vaccination given at a community clinic must also be entered into MyChart. If the patient is to receive one vaccine, enter the vaccine information in IMS Clinic and click Administer and Next Patient. If the patient is to receive 2 vaccinations, enter the first vaccination into MyChart, click on Administer, enter the second vaccine, and click on Administer and Next Patient. Please remember, the patient should not leave your chair until all documentation is completed. Primary care location documentation. Each vaccination needs to be entered into MyChart. If the patient is to receive one vaccine, enter the vaccine information in IMS Clinic, then click Administer and Next Patient. If the patient is to receive 2 vaccinations, enter the first vaccination into MyChart and click on Administer. Then enter the second vaccine, click on Administer and Next Patient. Document the vaccines administered on the vaccine log. Documentation at primary care locations is done in MyChart only. Please remember, the patient should not leave your chair until all documentation is completed. Vaccine and wasted dose logs. Vaccine and wasted dose logs are used to make error corrections and to investigate possible vaccine discrepancies. These logs must be completed at all primary care locations. Each vaccinator will be given a log to clearly document patient name or MRN number and the lot number of the vaccine administered. At the end of the clinic, vaccinators will give all logs to the charge nurse. The charge nurse will scan and email all vaccine logs to Alexis Crozel, and will leave physical copies of the vaccine and wasted dose logs at the primary care location for the lead MA to use for vaccine reconciliation. Printable copies of the vaccine and wasted dose logs can be found within the primary care clinic information document on Google Drive. Supervising providers. The supervising provider for patients under 18 is Dr. Deborah Langlois. The supervising provider for patients 18 and older is Dr. Julia Chin. Please note, if you do not enter the correct supervising provider, billing will be incorrect. Correcting MyChart documentation errors. If a lot number is entered incorrectly into MyChart, you can edit the documentation but must wait at least 5 minutes before correcting the error. If an incorrect vaccine type is entered into MyChart, it cannot be edited. You must first delete the incorrect documentation. Then, re-enter the correct vaccination documentation. We run daily reports to verify correct vaccine information has been documented in MyChart. If documentation errors are found, Alexis will email you a list of these errors with instructions on how to correct them. Please check your email daily and watch for emails from Alexis. Please be sure to review the immunization program for clinical nursing staff cornerstone module. It provides step-by-step instructions on how to correct errors in MyChart. Sharps containers. Sharps containers should be disposed of when they are 3/4 full, or within 18 months of the date the first needle was placed in them, whichever comes first. Previously, Michigan law mandated disposal every 90 days, but this has been changed according to the Michigan Health and Hospital Association. Nurses must bring their Sharps container to all clinics. When a Sharps container is full, get an empty container from KMS and leave the full container in the soiled utility Sharps transporter. Label your new sharps container with the start date and the dispose by date, which should be 18 months from the start date. Rest periods and lunch breaks. Employees may take a 15-minute paid rest period every 4 hours of work. The rest period is intended to be a recess to be preceded and followed by a work period. Employees scheduled to work 6.5 hours or longer may take a 30-minute lunch break, without pay, in a place that does not interfere with patient care. Lunches cannot be used in lieu of late arrival or early departure and must be preceded and followed by a work period. Arrangements for rest periods and lunch breaks must be made with the charge nurse. Please remember, food cannot be consumed at your station. Employee schedules. Scheduling process. Submitting availability. Joanna will send you an email reminding you to submit your availability. If you miss the deadline, you can still submit it, but you may not get scheduled. New employees must be available to work a minimum of 3 days per week. Receiving your schedule. Joanna will send you an email with a PDF attachment of your schedule. Review it as soon as possible and inform her of any potential errors or conflicts. Nurses, please keep in mind that we must follow UMPNC rules, which state that per diem staff are scheduled first, based on their per diem date and availability. If your availability is restricted to 1 day per week or 1 day per period, it may be best for the program to resign. Doing so will allow us to try to hire someone with more availability. The program does not have approval to hire new nurses unless it is to replace a nurse who has resigned. Time reporting. Time reporting for nurses. Always use the Excel template provided. Include all necessary information on your timesheet. Incorrect timesheets will be returned by email for corrections. Attach your timesheet to your email. Do not click on Share Document. We do not have the ability to view shared documents. To learn how to complete and attach your timesheet, watch the Saving an Email Attachment and Completing Your Timesheet video. Timesheets are due by 12 noon on Wednesday, but can be submitted early. Email your timesheet to the following email recipients. If you are scheduled to work Wednesday, Thursday, Friday, or Saturday, estimate the hours you are scheduled and submit your timesheet on Wednesday. Remember to submit an amended timesheet if your estimations are inaccurate. Do not rely on others to remind you to submit your timesheet. If you miss the submission deadline, you may not get a paycheck. Check your email regularly for important reminders or questions regarding your timesheet. Enter the total number of hours worked in the reg row. Enter the time frame in the hours worked row. If you work at a UM Health Center, you must enter the short code in the comments section. Short codes and other helpful health center information is included in a health center Google Doc that Joanna will provide to you. If you attend a training or complete Cornerstone learning, enter the total hours worked in the exceptions row and select HB from the pick list. Enter in the comments section, Cornerstone, BLS, etc. Do not enter the location where you are working. This information is not necessary and causes confusion. Enter your name, UMID, department, and supervisor. Time reporting for clerical staff. Enter your hours worked in the self-service time report located in Wolverine Access. If you work on a Saturday or Sunday, enter your hours in the reg row and enter the same number of hours in the VNW row. Doing this will pay you a shift premium that you are entitled to if you work on the weekend. Parking and mileage reimbursement. Parking. Parking locations. Staff can park in visitor or public parking garages and metered parking. Remember to submit parking receipts to Joanna within 30 days for reimbursement. Parking maps can be viewed at the following website. If you are unsure where to park, you can call Logistics, Parking and Transportation at 734-764-8291. Light Blue Parking Pass allows parking in blue parking spaces in parking garages. Cost is $6 per park plus a refundable $20 device fee if the parking pass is returned in good condition to Parking and Transportation Services. Staff interested in obtaining a light blue parking pass should email Joanna. Please include the requester's UMID. Once approved, passes can be purchased at Parking and Transportation. Passes are tied to the license plate of the purchaser and cannot be shared. It is your responsibility to park in a legitimate parking space. The FLUIMS program cannot reimburse you for parking tickets, so please plan ahead. Mileage reimbursement does not apply to travel to and from primary care facility clinics. If you are driving from home directly to a clinic, no mileage is to be reported. This is considered your commute to work. Clerical staff are reimbursed for mileage if they drive to KMS to pick up supplies. If you are picking up supplies from the office. 1. After picking up the supplies at KMS, track the total miles driven from the office to the clinic location and back to the office. 2. Log these miles on your mileage report. If you are not picking up supplies and your clinic is outside of the Ann Arbor area, track the number of miles driven from your home to the clinic and from the clinic back to your home. Then, deduct 50 miles from the miles tracked. You will report this number on your mileage report. For example, Pat drove 83 miles from her home to a clinic in Detroit, then back home. To figure out how many miles she can claim on her mileage report, Pat subtracts 50 miles from the 83 miles she drove. Pat can claim 33 miles on her mileage report. If Pat drove 40 miles from her home to a clinic and then back home, Pat will not have any mileage to report for reimbursement because she did not drive more than 50 miles to and from the clinic. The clinic Pat drove to was in Detroit. However, if the clinic had been in Ann Arbor, Pat would not report any miles. Please remember that our home base is Ann Arbor. If you live outside of the Ann Arbor area and are working at a clinic in the Ann Arbor area, you will not qualify for mileage reimbursement. For example, if you decide to move to Toledo, but still want to work for the FLUIMS program, you can choose to do that. However, you will not be reimbursed for mileage traveled between your home in Toledo and the clinic in Ann Arbor. The expense reporting system is Chrome River. You must complete the Chrome River training module in MyLink to gain access to Chrome River. Once you have access to Chrome River, log in. Add Tracy Newhouse as your approver. Add Joanna Gordon as your delegate. Add department, FLUIMS program, or 202089. Common questions. Should people with an egg allergy of any severity get a flu vaccine? Everyone 6 months and older with egg allergy should receive an annual flu vaccine. Any flu vaccine that is otherwise appropriate for the recipient's age and health status can be used. An egg allergy does not indicate additional safety measures for flu vaccination beyond those recommended for any recipient of any vaccine, regardless of severity of previous reaction to egg. Severe and life-threatening reactions to vaccines are rare but can occur with any vaccine and in any vaccine recipient, regardless of allergy history. All vaccines should be administered in settings in which personnel and equipment needed for rapid recognition and treatment of acute hypersensitivity reactions are available. Question: is it necessary to wear gloves when we administer vaccinations? In general, no. Occupational Safety and Health Administration regulations do not require the wearing of gloves when administering vaccinations, unless the person administering the vaccine is likely to come into contact with potentially infectious body fluids or has an open lesion on their hand. If a healthcare worker chooses to wear gloves, he or she must change them between each patient encounter. In response to the 2020 COVID-19 pandemic, the CDC has recommended the use of gloves when administering oral and intranasal vaccines to patients in communities where COVID-19 is circulating. Gloves are recommended to prevent contact with the recipient's potentially infectious mucous membranes or respiratory secretions. For more guidance on safe vaccination practices during the COVID-19 pandemic, see the following link. The Immunization Action Coalition has developed a handout on protective measures to take when vaccinating during the COVID-19 pandemic, available at the following link. Question: do you need to aspirate before giving a vaccination? No. ACIP does not recommend aspiration when administering vaccines because no data exists to justify the need for this practice. There are data that show that aspiration is more painful for the vaccine recipient. IM injections are not given in areas where large vessels are present. Given the size of the needle and the angle at which you inject the vaccine, it is difficult to cannulate a vessel without rupturing it and even more difficult to actually deliver the vaccine intravenously. We are aware of no reports of a vaccine being administered intravenously and causing harm in the absence of aspiration. Question: is it recommended to use a new alcohol swab to cleanse the skin before administering a vaccine, or can we swab the skin with the same alcohol swab that we use to wipe off the stopper on the vial? You should use separate alcohol wipes to clean the vial top and the patient's skin. Question: should we administer the recommended dose of the vaccine, or the entire contents of the vial even if it contains more than the recommended dose? In general, the entire volume should be used even if it is a little more than 0.5 milliliters. Discarding the excess vaccine is not required or recommended. An exception to this is recombinant zoster vaccine, such as RZV, Shingrix, or GSK. The RZV adjuvant solution may contain up to 0.75 milliliters of liquid. The entire volume of the adjuvant solution should be withdrawn and used to reconstitute the lyophilized vaccine. After mixing, withdraw the recommended dose of 0.5 milliliters. Any reconstituted vaccine left in the vial should be discarded. Question: is it recommended to change needles after a vaccine dose has been drawn into a syringe? No. It is not necessary to change the needle if it has passed through 2 stoppers, which is done when a lyophilized vaccine is reconstituted. Changing needles is a waste of resources and increases the risk of needle stick injury. Question: some single-dose manufacturer-filled vaccines come with an air pocket in the syringe chamber. Do we need to expel the air pocket before vaccinating? No. You do not need to expel the air pocket. The air will be absorbed. This is not true for syringes that you fill yourself. You should expel air bubbles from these syringes prior to vaccination to the extent that you can do so. Question: I've seen the recommendation stating air bubbles in manufacturer-filled syringes do not need to be expelled. Can you explain why those air bubbles can be injected, but air bubbles in user-filled syringes must be expelled? It is not wrong to expel the air from syringes filled by manufacturers. But typically it is such a small amount of air that it is the CDC's opinion that it would not cause a problem. When the syringe is inverted during an injection, that small amount of air typically clears the medication from the needle. This is based on the recommendation that when the Z-Track method is used for intramuscular injection of irritating medication, the guidance is to leave 0.2 cubic centimeters, 0.3 cubic centimeters in the syringe to be sure that all the medication leaves the needle and is not tracked back through subcutaneous tissue as the needle is withdrawn. While the Z-Track injection technique is not recommended for vaccine administration, the Z-Track method demonstrates the acceptability of leaving a very small amount of air in the syringe for intramuscular injections. The CDC does recommend that when drawing vaccine from a vial into a regular syringe, the air be expelled because the amount of air drawn into the syringe may be larger than the amount in a manufacturer-filled syringe. Expelling the air is part of general medication guidelines for drawing medication into a syringe. Certification and trainings. Cornerstone. Every module in Cornerstone needs to be completed, even if it is not relevant to the FluIMS program. Nurses who work for the FluIMS program must complete all modules that are required for any nurse who works for primary care. Annual performance evaluations are to be completed in Cornerstone. When your self-evaluation is due, please complete it. If you miss the deadline, you will not be able to access your evaluation. Peer feedback is recommended. As an employee, it is your responsibility to keep up on emails and Cornerstone learnings. These channels provide both required training and professional learning opportunities you may find interesting. Check your email at least once a week throughout the year, even during the off-season. Digital disruption. Digital disruption refers to an unplanned event, such as cyber attacks, a network outage, or loss of power, that interrupts access to critical digital systems like MyChart or disrupts clinic operations. If MyChart is unavailable, clinic staff should document vaccines administered on downtime forms. Once MyChart is back online, immunizations documented on downtime forms must be entered into MyChart. Forms containing patient immunization details not entered into MyChart should be brought to the main office for proper handling. A copy of the downtime form can be found in the clinic notebook. Charge nurses assigned to the first clinic of the season should make copies of the form and place them inside the supply room. In the event of a power failure, the clinic should be closed. It is not safe to administer vaccines with little to no light. Signs must be posted that explain to patients why the clinic was closed and should include the call center phone number to reschedule their appointment. UMH abuse and neglect. Identification, assessment, and response policy. At UMH, every team member has a responsibility to protect patients by reporting any suspected abuse or neglect immediately. This updated and consolidated policy supports our commitment to high reliability and patient safety. It clearly defines abuse and neglect, outlines required standards, and details the procedures all workforce members must follow. Key objectives of the revised policy: promote a culture of safety for all patients, ensure compliance with federal, state, and local reporting laws, establish and reinforce clear reporting procedures, define steps for the assessment and response to suspected abuse or neglect, support staff training to recognize signs of abuse and neglect. While the responsibility to report abuse and neglect is not new, this revised policy provides a clear and consistent process for all workforce members. Please review the UMH abuse and neglect, identification, assessment, and response policy to understand your specific role in reporting and advocating for patient safety. Competencies. Charge nurses need to complete the charge nurse competency if we do not have a copy of it in your HR file. Please see Tracy or Joanna to verify. Nurses should watch the following instructional videos: adding primary care locations and insurance columns to nurse schedules, health maintenance and refresher on IMS, clinic documentation of immunizations, saving an email attachment to your desktop and completing your timesheet, anaphylaxis hypersensitivity documentation using smart phrases and smart sets, how to use the ACTO vial registered system. Registrars should watch the following instructional videos: registrar role and responsibilities. Additional information: a clinic notebook containing standing orders, emergency management protocols, and other useful information will be available at every clinic. You will also receive a Google Drive link to access electronic versions of materials discussed in this orientation video. Email is the easiest way to reach Tracy Newhouse. She will typically respond within 24 hours. Please do not call or text Tracy unless she needs to take action right away. For example, if there is an emergency at a clinic or it's after 5 p.m. and you need to call off of a clinic scheduled for the next morning. Please note that Joanna's work schedule is Monday, Tuesday, and Friday. Call Tracy or the office on Wednesdays and Thursdays. Thank you for your attention and welcome to the immunization team.